All right, let's finish up the skeletal system and specifically joints, talking about arthritis. So, arthro, joints, itis, inflammation. Arthritis just means inflammation of a joint. There are many types of arthritis. Um, and there are many types of arthritis we're not going to talk about, such as psoriatic arthritis. We're going to talk about the two most common types of arthritis, plus another one which has kind of become a lot more relevant to the college age population than it used to be even 5 or 10 years ago. So, just going to hit a couple of highlights about three different types of arthritis. And the first type of arthritis is osteoarthritis. So, osteo, bones, arthritis, joints. So, osteoarthritis is an arthritis that affects your larger weight-bearing joints. So think your knees and your hips. And this is your classic wear and tear arthritis due to repetitive trauma. It's the type of arthritis that every professional athlete is going to have. They have a great career in their 20s, and by their 40s, they are hurting from their arthritis. Because what has happened because of the repeated injuries, that beautiful glassy hyaline cartilage they had kept on being injured and injured and injured. And remember, we're not making any new cartilage as adults. There's no blood supply. And so that cartilage is deteriorating over time. And so that joint space is getting narrower and narrower and narrower. And eventually, what is going to happen is that joint space can become essentially non existent. And you can have bone grading on bone, and wherever the cartilage has disappeared and you have bone grading on bone, you're going to start developing osteophytes, or what you call bone spurs, abnormal little bone growths. Because wherever you have bone being irritated, you're going to get bone growth. So, looking at a low power view here on the bottom left, you can see the normal black space between the femur above and the tibia below with the blue arrows. And then on the right, you can see how there is almost no space where there are red arrows on the right. Now, the x-ray on the right is a split screen, where on the left you have a normal knee showing the normal width because there is normal cartilage on both the femur and on the tibia, whereas on the right, the joint space is quite a bit narrower, as well as the black arrows are showing these extra little bony growths on both the femur and on the tibia. And so it's super important that even though you have arthritis, you continue to exercise. Yes, you're going to have to limit your exercise, because if you're exercising and you're hearing that knee go, that's not good. You need to do the exercising to the point where you start hearing the and stop the range of motion there, because if you continue doing it, then you're just going to get more and more bone spurs. Anyway, osteoarthritis, large joints, wear and tear, losing the joint space. All right, the second type of arthritis is one you probably have heard as well, and that is rheumatoid arthritis. And this one, as opposed to affecting your larger joints, this one affects your smaller joints. So especially hand joints are very commonly affected. And this is an autoimmune disease. In other words, auto meaning self. Your immune system is attacking itself. It's attacking the tissues in your joints. And so what happens is the synovial membrane becomes very inflamed, and the synovial space becomes narrowed, and the cartilage, because of the inflammatory process, there is scarring there. And so the joint space becomes narrowed, and the scarring just becomes more and more progressive. And so that normal water balloon just becomes massively deformed. And in fact, it will cause dislocations at these small joints as you continue to use these joints. And the classic is at these knuckles between these metacarpal bones of your palms and these first phalanges here. And we have what is called an ulnar deviation. Do you notice that these are tilted towards the pinky finger side? Okay. It's not tilted here at the wrist. These bones are going this way, but those are tilted this way. Okay. And that's because this joint right here has been destroyed. And this is a classic joint that is affected with rheumatoid arthritis. This is not the arthritis that ladies who sit there knitting 10 hours a day get. Their arthritis is going to be an osteoarthritis and is usually going to affect these joints. They're not going to get this ulnar deviation from rheumatoid arthritis. So if we look at x-rays of the hand with rheumatoid arthritis, you will see that what happens is as these joints get destroyed even more, it's going to fuse. Do you see how like this phalanx is not even attached to this other bone anymore? It's way off to the side. They're totally dislocated. Okay. So these gentlemen and they have problems with their small joints. Okay. Now the third type of arthritis is called gouty arthritis, and that has to do with a substance called uric acid or urate, which is a waste product of nucleic acid metabolism. And so this is very important with alcohol and protein intake. So it used to be common in, like, for instance, royalty in Europe when you would have bacchanalia. But now what we find, especially in young men who have high protein intake, going to the gym, working out, adding all the extra protein powders, and having keto diets where they have basically protein after protein after protein. And then on the weekend or even on weekdays, having massive amounts of alcohol and or going to Coachella and being dehydrated. And what happens is their uric acid levels go sky high. Well, the kidneys can't handle that. And so the uric acid gets deposited in their kidneys and in their skin and in their joints. And this big toe is a classic place where people go and they got pain in the big toe. But like I said, it also can be deposited in the skin where you could end up with huge, what feel like bony deposits because these are crystals of uric acid. So think of a hard crystal tucked under your skin. Not a good thing, okay? So watch your alcohol and protein deposits. And yes, this stuff can totally destroy your bones. Do you see how the bone is gone? Yes, pay attention to your diet. A keto diet is not good for you. High alcohol, high protein is not good for you. Your body does not like that. Okay, that's my service for the day. All right, and with that, we are done with the skeletal system. Thank you so much, and I'll see you when we return for our next organ system. And thank you once again for all your hard work in this course. Bye.